This month marked Cancer Awareness Month, which is used to educate people about the different cancers and to encourage people to do regular testing for early detection. Now, despite it being uncommon, male breast cancer cases account for 1% of all breast cancers. It is 100 more times common in women. According to the Cancer Association of South Africa, in 2018, up to 400 men were diagnosed with breast cancer in the country. We now speak to Graeme Comrie, a breast cancer survivor, and Dr. Fatima Hoosain, a surgeon with special interest in breast cancer, who was part of the team treating Comrie. Good morning to the both of you, and thank you so much for your time.
Good morning. Thank you for having us.
Good morning. Thank you so much.
First and foremost, Comrie, let's start with you, and let's start right at the very beginning. When did you first notice the signs?
It was a while back now. It was around 2005, 2006, some 20 years ago. I was very careful to try and do the best I could for my health. And I used to have annual checkups every year as things went by. But they tended to be on normal things, such as diabetes, issues such as your cholesterol and so on. And it was only towards the end of 26 that I found that I started to feel that there was a lump just above my heart on the left-hand side. It didn't concern me. There was no pain, there was no bruising, there was no discomfort, but I was not happy with it. But I lived with it. I didn't realize that it was possible anything else but just a lump.
And just for the purpose of understanding the conversation more in depth, what was your medical profile at this point in time? I mean, first of all, does cancer run in your family? Let's start there.
No, cancer did not run in my family, not that I was aware of. My dad died relatively young, but generally speaking, there was no cancer. My mum lived to the age of 95, so I was not aware of any cancer issues in the family.
So, doctor, I'd like to bring you in here. What causes breast cancer, and is there a difference between the cause in men and in women in the cases that you have handled?
So as far as breast cancer in males is concerned, the causes are pretty similar, except the genetic risk plays a significantly a bigger role. So it's a genetic predisposition towards breast cancer about 2 to 4 times more common in males than it is in females. Apart from that, I mean, the usual concerns, high estrogen levels, obesity, lack of exercise, environmental factors, all play as much a role in men as it does in women.
How often do men need to get tested for breast cancer, doctor?
So unless a male is a known carrier of a genetic mutation, particularly the BRCA1 or BRCA2 mutations, we don't actually screen men for breast cancer because it's not really as common as it is in females. It affects men far more infrequently than it does in women. I think the incidence in men is about 1 in 1,000, maybe even more. So it's not something that we screen for in males. It's unlike like prostate cancer, which is far more common in males. So ideally, it's to know your genetic profile, to know what genes the family carries, and if so, then to tailor the screening for the males in the family, particularly in that scenario, if they do carry a mutation that increases their risk.
And then in closing, doctor, and very briefly, what are the telltale signs for men especially to look out for?
So very much similar to that in women. It's a lump in the breast, occasionally and very rarely pain, any distortion in the breast. So we talk about dimpling or pulling in of the skin, a nipple discharge, which is obviously not supposed to happen in males at all. All of those signs are exactly the same in women. And of course, lumps under the arm, we mustn't forget that the lymph nodes can also be involved in male and female breast cancer. So not to forget to examine those as well.
Graeme, in closing, we've often heard and we know the struggle is real when it sometimes comes to taking men to doctors or them taking themselves to see a doctor. What advice do you have for all men out there?
I think it's essential that they need to go for the annual checkups. It worked for me, and I think that's an important point that I wanted to make. It's now some 15 years since my diagnosis and treatment and surgery, and I have in 100% health as best I can at my age. So I think it's absolutely vital that men continue, and not continue with the checkups, not only just for the normal bloods and so on, but to have the check for the lump. Just the breast examination and the man, equally important than all the other important tests such as cholesterol.
All right, Doctor, thank you very much for your time. And Graeme, thank you so much for sharing your story. We appreciate the both of you.